Hi, I'm Snarr. I'm a PA with Idaho Spine Sports and Rehab, and I'm here this morning with Nate Hunsaker, Doctor of Physical Therapy and owner at Rehab Authority. Thanks for meeting with me this morning.
Thank you. This is my first Facebook Live event, so
yeah, I'm like, wow,
I'm high tech now. This is great.
Well, so I'm with a doctor's office. We specialize in physical therapy and rehabilitation and sports medicine. And we oftentimes refer patients to physical therapy, different clinics here around Idaho Falls, including your clinic, of course. And at our office, we see a lot of patients, knee pain, shoulder pain, back pain, neck pain. We basically see it all. And oftentimes we will refer patients to the physical therapist to start some treatment. And one of the first questions I get from patients, of course, is, well, why physical therapy? What's the purpose of it?
Yeah. Well, first of all, I want to send a shout out to you guys because Eastern Idaho Spine Sport and Rehab is like cutting edge medicine in this town of Idaho Falls, which is pretty amazing. I mean, these guys are doing incredible stuff that you just find in big cities, and I know there's people from all over the West that come and see you to get procedures done.
They do.
As far as you know this cutting edge thing of regenerative medicine that's happening now. It's amazing that right here in Idaho Falls we have a center that is doing this stuff that you guys are doing. So hats off to you guys. They're just a tremendous addition to this medical community here. So thank you for the work that you guys are doing.
I appreciate that.
But we get that question a lot too, and I think as a profession maybe we haven't defined ourselves really well. But when you think of physical therapists, what you probably should think of is our movement experts. Okay, we're seeing so many people that want to stay active clear into their 70s or 80s. I mean, very active, and we're talking like athletic type active. And these bodies of ours are made to last a while, but they start to break down, and as we get older, they start to break down. So when you think of musculoskeletal injury or musculoskeletal problems, a physical therapist is very well equipped to take care of those things. So when I try to describe to people what we do, well, that's what we are. We're movement experts. There are so many things that happen to us, whether it's just a bump of the knee or something neurological that happens that can alter movement patterns. And I always tell people this kind of example, you can have a car and with one tire out of balance and you can still drive that car, but eventually that tire being out of balance is going to transfer through the car to cause other problems. So, we find a lot of people who would just, gosh, this pain has started 6 months ago and it's just gotten worse and worse and worse. And it's because movement patterns have been interrupted. And when a movement pattern's interrupted, you start to get a breakdown up the chain, whether it's from the ankle, you start getting knee pain, hip pain, back pain. And so what we're here to do is analyze all of those systems, take into account, what part of that system is broken down, try to get to the root of it, because you can be coming in for, well, my back hurts, and maybe we find out that, well, your knee is there's some muscle imbalance in the knee that might be causing some of that. We do treat the back as well, but you got to get to the root of the problem. So I think we're just well equipped as far as our training to look at the human body and go, that looks wrong, that looks like that angle is off or that muscle action is off. Let's correct that and then get you back to the life that you want to lead. Because to be active into your 70s and your 80s, you have got to keep that machine fine-tuned. And
Absolutely.
so anyway, that's, I guess, the short and the long answer for it.
I loved your car analogy because I actually see patients quite a bit where originally maybe it was their knee that was bothering them 5 years ago, but now their ankle hurts and now their hip hurts, and now they're finally seeing us because they can't handle their back pain anymore.
Right. Yeah.
So I mean, we see that all the time in clinic.
Oh yeah, there's so many. You look at that's why I love being a physical therapist, because the human body is unbelievable. The way it can adapt to things. But sometimes that can be your enemy too. The body is so good at adapting and compensating that it will take the strain off of something, but then that starts to cause another system to break down. So it's, and that takes a person who can really look at the whole human system and go, okay, this is off, maybe this alignment is off. I mean, that takes a lot of training, and that's
Sure.
why, I mean, we go to 7 years of schooling to try to figure all this out, and then additional training on top of that, which you guys do as well. So I
Right.
think we're just one part of that musculoskeletal expert group, which you guys fall into that as well, physiatrists and PAs in physiatry. I think that's the same. We're kind of experts in that pool of healthcare professionals. So.
Sure. And would you agree too, even maybe like an athlete, somebody who's really healthy, even they can benefit from physical therapy? Because sometimes I'll even hear from patients, oh, I'm healthy, I'm fit,
Yeah.
I go ahead and run 2 miles on a weekend, why didn't I need to go see a physical therapist? Why couldn't I just Google maybe some exercises online and just do that on my own? What would you say about that?
It's you have to be careful if your primary care physician is Dr. Google. I think you got to be kind of careful.
Yes.
There's a ton of information out there, but for instance, let me just take an example with a spine patient, with a back patient. Someone comes with a low back pain. Low back pain is not low back pain. Is not low back pain.
Mm-hmm.
Just like if you went into a doctor with chest pain, that could be coming from your heart. It could be indigestion. It could be gallbladder. Chest pain is not chest pain. Is not chest pain. If you went to somebody and said, "Well, it's just chest pain. I'll just treat it with whatever," if you gave everybody nitroglycerin for chest pain, you'd be in trouble. So when you come to a physical therapist, you find out, okay, what kind of back pain do I have? Because if you are at home and Google back exercises, you're going to get a million hits, and about 50% of those or more are going to make you worse if you do them. So it's really beneficial to go to an expert who knows what to look for. And, I mean, you can argue, a physiatrist is not a physiatrist is not a physiatrist either. I mean,
Sure.
every physical therapist isn't super skilled in everything. So we here at Rehab Authority, we specialize in spine care. So we do a lot of spine work, and we're trained in and certified in extra things on and above our training in school
Sure.
to really look at those spine problems and try to sort them out. So it's a wonderful age we live in where you can just type, you don't have to wonder anymore. That's what the internet is pretty crazy about. We never have to wonder about things. We just type in something, we know it. But that can be a problem too. So, and you've seen that, I'm sure too.
Oh, yes.
Yeah. So you gotta, you can't get very specific with a search on Google on what exactly you should be doing.
Sure.
So.
And my understanding is when you first see a patient, you do a very specific evaluation to see exactly what their back pain is.
Right.
And then you customize a treatment plan based on that, correct?
Exactly, yeah. That's the only way to do it. And I think the luxury we kind of have as physical therapists that physicians don't always have, because there's so many patients coming in, so busy. Doctors don't get a lot of time with a patient. We take an hour for an evaluation. We seriously, if we do it in under an hour, I don't know that we're doing a very specific job. So we have that luxury. We have a lot of time to look over the problem and really investigate very deeply to solve that mystery, because every patient is a mystery when they come in.
It's true, and I completely agree with you. I think it would be a disservice on our end, because when I have a patient ask me, well, can you show me a few things?
Yeah.
Yes, I can show you a few things, but I didn't really take the time with you to really say, well, these are the best exercises for you and your problem.
Exactly. Yeah.
So I think that's exactly what we see in our clinic too.
Yeah. You guys are very busy, so it's nice that we kind of have that time to be able to really sit down and ask the right questions, take them through the right movements to sort things out, and then be able to prescribe something. We really, here, we try to prescribe exercise as definitively as you would prescribe a medication. We can't prescribe medication, but we can prescribe exercise. And to me, you owe it to a patient to be that precise with that prescription as you would be in a medication with someone. So
sure, and that preciseness comes from your specialty in musculoskeletal. You know exactly how muscles function, joints function, everything. So okay. Tell me, so I often get patients who ask, well, what's the difference between a physical therapist, an athletic trainer, personal trainer? Because I'll have patients be like, oh, I have a personal trainer, why can't they just help me with this problem?
That's a great question, and I think that's I think the deeper question to that is sorting out, okay, athletic trainer versus personal trainer, because those are two different things as well. Athletic trainers have a bachelor's degree, and in fact, by 2020, the National Athletic Training Association is going to require all athletic trainers graduating from that point on to have a master's degree. So these are very well-trained professionals.
Sure.
And they train in anatomy, physiology, but the Centers for Medicare and Medicaid Services, which is kind of the driver of how all insurance payers pay out and what they pay for, they don't recognize athletic trainers as allied health care professionals like you, like me, like even chiropractors.
Sure.
So they're not recognized as a healthcare professional, so they really aren't reimbursed by insurance, and so that's the difficulty. So you got to kind of, and you're not going to find athletic trainers around here very much. So usually people around here are talking about training, athletic trainer, are talking about a personal trainer.
Okay.
Now personal trainers, they have very little education. I mean, that you can be certified as a personal trainer in about 2 to 3 months.
Okay.
So I'm not saying they're not educated. Obviously they go through some training, they get a certification, but they're more for exercise prescription in the gym on here's a good program for you to be doing in the gym. Mm-hmm. So as far as diagnosing problems, being able to sort out which exercises might be best for you, that they don't always do that very precisely. So around here, a physical therapist is going to have the ability to diagnose musculoskeletal problems much more precisely, I think. Okay. And the ability to have your insurance reimburse that. I mean,
that's nice too.
I mean, that's very important. Physical therapy is very well reimbursed by almost every healthcare plan. We've established ourselves as professionals that can really make a difference, and that's why that recognition has been given to us, and the ability to bill insurances and get reimbursed. So, when it comes down to it, we all talk about healthcare costs and how horrendous they are, and they are horrendous.
Absolutely, yes.
Thank heavens we do have insurance, and thank heavens that most insurances cover physical therapy. So, yeah.
Well, and I think the nice thing with physical therapy too is compared to a lot of treatment options out there, I think physical therapy is more on the affordable end.
It is, yeah.
And not only that, I feel like a lot of times, even if we were to do some sort of procedure, if we don't do physical therapy to correct the underlying problem, you're just wasting your money and time anyways, because you need to strengthen, recondition those muscles, get to the problem at its base and core, as opposed to just trying to do a quick fix and then really not fixing anything, maybe just a temporary band-aid type of situation.
That's so true, and I think people sometimes they almost separate us too much. Like, I either go get an injection or some procedure, or I do physical therapy. Mm-hmm. We often work together on that kind of stuff. We do. The injection sometimes is important and necessary, and then we can follow up with the injection allows us then to do movements that are therapeutic, exercises that are therapeutic to correct the condition that we couldn't have done without that injection on board. Mm-hmm. So I think when you're thinking about treating a problem, you shouldn't maybe think about compartmentalizing all these different cares, that really we can work together.
Oh,
and
yes.
And it works out very well.
I mean, I know at our office we definitely consider physical therapists exactly that, our allies, our partners in patient care. I feel like we really shortchange our patients if we don't get physical therapy on board. Yeah,
and the other thing that people don't realize is that Idaho is awesome in that it's a direct access state for physical therapy. For most insurance plans, you don't have to access a doctor first to come into physical therapy.
That's really nice.
So there are oftentimes we get patients here that have not seen a physician, and we refer out a lot of things. Like if I'm working with a patient and I'm not seeing results in 5 or 6 visits, 2 weeks-ish, I am looking to, we probably should get you to someone who can take a different look at this. Yes. And typically a physician, and most of the time a physiatrist.
Yeah, so, and we really appreciate that, because then we know that when a patient comes to see us, they've already tried the basic things they should already be doing, and so then we can go ahead and be a little more aggressive with treatment at that point.
Yeah, exactly, yeah.
So I think that's great.
Yeah.
So another question I have for you, because sometimes I will get patients who come in and they've been like, well, I've already tried physical therapy, maybe for the same problem or maybe even another problem, and so now they're hesitant to look at physical therapy as an option again in the future.
Yeah. So, and again, I think let's go back to what I said toward the beginning of this whole thing is a physical therapist is not a physical therapist is not a physical therapist. I mean, in every profession you have good ones and you have not so great ones, and so you do as a patient, you need to take charge of your health care. You know, you're the consumer, and so you have the ability to call the shots. You really do. I mean, I rely on patients paying me and their insurance paying me, and you have every right to look at me and scrutinize me as far as my skill goes, because you're paying the bill.
Absolutely.
So what I would recommend to patients is if you have tried physical therapy before and it's getting recommended again, that you really do your research. You look, most clinics have a website, and if they don't have a website, I would kind of be cautious right away because you should kind of be in this kind of mode with doing Facebook Live and stuff like this. So they have websites, they have profiles of the therapists that are treating, and in those profiles will typically have any extra training those physical therapists have had.
Okay.
So you're going to have physical therapists who come out of school and are satisfied with the training they had in school, which, that's good training. But I am of the firm belief, and we're really required in the state of Idaho, that you must continue your training, okay? Now, there are so many certifications out there that a physical therapist can get in numerous things. So I would look for not only you'll always see the PT, DPT after a therapist's name. Look for other letters. Look for other alphabet soup.
Sure, it shows more certifications.
It shows more certifications. I'm a PT, DPT, Cert MDT, which is certified in mechanical diagnosis and therapy of the spine and treatment of the spine. And then I'm also a CSMT, which is a certified spinal manual therapist. So I'm certified in spinal manual therapy. So you'll see kind of this alphabet soup starting to happen after the name. Well, that shows you that therapist is serious about his training. He or she is serious about continuing that education and getting better, and really focusing in on one area. So, for instance, I don't do hand therapy. If a patient comes to me with a hand problem, I refer them somewhere else because I have not trained in that. I don't feel confident in doing that. So, any good therapist would probably go, if they don't feel comfortable, they'll refer you somewhere else. But I'd say if you're referred again and you've tried it once, it hasn't worked, look a little closer to who you're actually going to. Make sure you're getting the guy who really, or the gal who's really focused on that area.
And that makes sense. I mean, if you think about how complex the whole body is, to be like, oh, well, I am completely 100% the expert on every single portion of the body. I mean, that's a lot to take in.
It is, yeah.
So for you to be certified in specific parts of the biomechanical forces of the body, I think that makes sense.
Oh, exactly.
The other thing I wonder about too sometimes is if maybe a patient, if they didn't get success with physical therapy, how much of it did they really put on their side, like the effort that they put into physical therapy?
Exactly.
Because you do have physical therapy appointments, but then there's also the physical therapy that you do on your own at home, correct?
Yes, exactly. So we are very focused on the patient taking over their care, because ultimately this is their problem. To have a health problem and just expect someone else to fix it, it's kind of the mode of thinking that a lot of America's in, and it shouldn't be that way. You should take care of your own health. Yeah. So we try to really get patients going on a home program, because ultimately they're going to need to continue that. Most of the patients I see need to look at an exercise program as like blood pressure medication. You just take it every day. There's no reason to skip it. So yes, I think, if you have not done what your therapist has told you to do, you can't expect great results. So you've got to be vested in it. You got to be vested in your health and within the outcomes that you want. So that's a very good point. Yeah.
Hey, well, thank you. I really appreciate your time this morning
You
with
bet,
that.
yeah.
I don't know if there's been any questions. Okay. But while I have you here, I know
Yeah.
that there's a few more things that you guys have been working on that you're bringing
Yeah.
to the clinic.
Yeah, we're excited. We've we're always at Rehab Authority. We're always trying to be innovative, always trying to stay up on the latest, greatest thing. And one of these things that has just been coming out in the last few years is a thing called blood flow restriction therapy.
Okay.
It's a really interesting concept. It's really quite simple, but you basically restrict the blood flow to a limb, like say your arm,
Okay.
and by putting a cuff around that arm and blowing it up to a certain pressure to kind of restrict, not occlude, but restrict the blood flow. You trick the body into thinking it's working way more than it is, and so
okay.
you can actually cause muscle growth in a much more accelerated way than you typically would.
So that would make sense. So
Yeah.
kind of like an anabolic state is what
Exactly. Yeah.
Okay.
So the science behind it is pretty solid. There's a lot of good research coming out about it. We're getting a system here within the next week that we're going to start using to kind of treat some of the patients with. This is very helpful for kind of more the elderly population as well, because they can't always grab a 40-pound weight and do bicep curls with
Sure.
it, or do work with their shoulder with a lot of weight. But
Okay.
you can diminish the weight down quite a bit and get the same result. So
Okay.
very exciting stuff. So we're excited to get that in here.
So that really opens the doors for a lot of patients then.
Really does, yeah. Just for strengthening, just trying to get a limb more, get a limb stronger and get the joints around that area more stable through that muscular growth. So
Okay,
we're
great.
excited about that. Another very exciting thing for the whole state of Idaho and for therapists in the state of Idaho is the ability for us to do dry needling.
Oh,
So,
yay.
yeah.
That makes me excited.
So every state around us has figured out this is a good thing for therapists to do.
Yes.
We're just kind of behind the times and just trying to get this. But we got a great president of the Idaho Physical Therapy Association that's really pushed this through Congress and got it passed and put into our Practice Act so that we can do this. Now, dry needling is not acupuncture. Although it uses acupuncture needles, we don't profess to be acupuncturists, and we don't use it in that same way where we're sticking meridians and doing things like that. I know Dr. Black does a wonderful job at acupuncture. She's a very good acupuncturist. So we're not trying to tread on their ground at
Sure.
all. But dry needling is a much more specific technique where we would dry needle trigger points, we dry needle muscles that are tight, we would be able to do just very specific treatments in muscle groups.
And that makes
So,
me really happy actually,
Yeah.
because so for example, I do a lot of trigger point injections at the office, but then I'm like, okay, let's get you over to your therapist.
Yeah.
But now that you can do some dry needling there while you're seeing the patient,
Exactly.
I think that's the perfect combination.
Yeah, it's very exciting. So this is that we just got actually just yesterday. It passed through the Senate committee.
Yay,
So
okay.
it already passed the House committee yesterday. Passed the Senate committee. So it's going to be in place to do in March. However, there are very good. We put in place very good regulations so that you have to show that you've been trained. You have to have so many hours in the training to do it. Be certified in it. So even though it's legal to do by March, if you go to a therapist and they're going to dry needle you, make sure they're certified. Make sure that they, we're hoping everybody doesn't try to walk the line on this. I know they won't. I know
Sure.
my fellow therapists are just full of integrity in this state. So, but we got very good regulations in place. So just not anybody's just gonna be sticking needles in you. These guys are gonna be trained. I'm going to my first course here in April, so we should be
Awesome.
getting trained up pretty soon. So
Okay, well that makes me excited.
So yeah, we're excited about that.
Awesome.
Great.
Okay. I don't know if you have anything else that you want to add this morning.
No, just stay moving. I hear
Motion
you.
is
Motion is
lotion,
lotion.
is what
Motion
we
is lotion.
say.
It totally is. So just keep moving. Seek out healthcare professionals that can analyze these things, like the folks at Eastern Idaho Spine, Sport, and Rehab, and us here at Rehab Authority. We'd love to take care of you, and I'm so excited about the musculoskeletal medical community in Idaho Falls.
Yes.
I don't think people realize there's a lot of people that go out of town to get procedures done. You don't have to do that. There are some wonderful clinicians and practitioners in this town. We are very blessed to have the medical community we
Yes,
have.
and we have
So,
quite a few here
we
too,
do,
so
yeah.
we're really blessed that way.
Thank you.
Hey, well, thank you, and thank you guys.
Thanks, guys. See ya.
See ya.